Hi, I'm Caitlin. I'll be your student physical therapist today. Can I have you verify your name and date of birth?
Sure. Alia Raghunauth, 12/31/94.
Nice to meet you, Alia. What brings you in today?
I am having some shoulder pain in this shoulder.
Okay. I'd like to ask you more about that. Is it okay if I take some notes while we talk, just so I can have correct documentation?
Yes.
Okay. Have you seen your physician about the shoulder injury?
I haven't.
No? Okay. When did this happen?
About 2 weeks ago.
Okay. Are you currently in any pain?
Yeah, I'm feeling some pain there.
Okay. On a scale of 0 to 10, where 0 is no pain at all and 10 is the worst pain imaginable, where would you rate your pain right now?
Right now my pain is at a 4.
And in the last 24 hours, what's the best that it's been?
It is at a 3.
Okay. And in the last 24 hours, what's the worst that it's been?
8.
An 8. Okay. And what would you say has brought your pain from the 4 that you're at now up to that 8 that it's been in the last 24 hours?
Sometimes I play some instruments, so if I'm doing that for a long period of time, I think it's getting some strain on my shoulder.
Oh, what kind of instruments do you play?
I like to play with drums and guitar.
Oh, nice. Love those.
Yeah.
And what would you say has brought it from that 8 that it is after playing instruments back down to that 3? What do you do for that?
I just put some ice on it.
Icing it?
Yeah.
Okay. And about how long does it take after you're icing it for it to start to feel better?
About an hour.
Okay. And how would you describe your pain?
It's aching.
Okay.
Yeah.
Persistently?
Mhm.
You said this happened 2 weeks ago, right?
Mhm.
In that 2 weeks, would you say it's gotten better, worse, or stayed about the same?
It's getting worse.
Worse.
Yeah.
Okay, well, I'm sorry to hear that. Hopefully we can get you feeling better. Are you currently taking any medicine, either for the pain or just in general?
No.
No meds? Okay. What is your caffeine intake like?
I drink a cup of coffee in the morning.
Okay. Pretty regularly, 1 cup every morning? And how about your alcohol intake?
I don't drink.
Okay, and tobacco?
I don't smoke.
For your family history, is there any family history of hypertension, diabetes, heart disease, cancer?
Yeah, in my mom, there's cancer in that side of the family.
Okay, what kind of cancer is that?
Breast cancer.
And how long ago was that?
About 4 years ago, but she's in remission now.
She's in remission? Oh, glad to hear that. Thank goodness for that. Do you have any other new or unusual symptoms that are happening other than your shoulder pain?
I've been getting some headaches. Yeah.
How often are you getting your headaches?
It's usually before bed, at the end of the day.
Okay. Is there anything that you're doing throughout the day that could be causing your headaches every night?
I wear contacts. I'm not sure if that has anything to do with it.
Okay. Does your physician know about these headaches?
Yes, I did mention it.
Did he say that it could be related to the contacts?
Yep.
Okay. Has he sent you to see your eye doctor?
He said that I could take a visit if it gets worse.
Okay.
Yeah.
Has it been getting worse since you've been talking?
Not really.
Okay.
Not really.
And is your physician treating you for your headaches at all?
Right now he just said to get some rest, to kind of just take a break from the contacts every now and then. So, kind of been adhering to that.
Okay. Is there anything else you would like me to know about?
No, other than the fact that I just hope that I can get to playing instruments soon without pain. You know, I just don't want the shoulder to get worse.
Yeah, that's totally understandable.
Okay.
Well, hopefully we can do some tests and see if we can get you feeling better here soon, okay?
Great, thank you.
Thank you. Hi, I'm Caitlin. I'll be your student physical therapist. So today we're going to be listening to your lung sounds. So I'm just going to be using a stethoscope and placing this on a few places on your chest. It might require us to make a little bit of adjustments to your clothing if needed. Is that okay?
Yes.
Okay. Be sure to explain to the patient that they will need to take deep breaths in and out as the stethoscope moves to each new site. While doing lung auscultation, you are explaining to the patient that there are 7 spots on the front and 10 spots on the back where you are ensuring that you are hearing that their lungs are clear and free of crackles or wheezing. Crackles are defined to be discontinuous brief popping lung sounds when they are coarse, and when they are fine, they are defined to be louder and lower in pitch. Wheezing is caused by a narrowing in the airwaves and are adventitious lung sounds that are continuous with music quality. Sometimes when you are doing lung auscultations, it will be necessary to make adjustments to the patient's clothing to gain access to the sites. You want to make sure you're always doing this in a respectful manner and that you're always asking the patient for permission. Sometimes it may even be necessary for the patient to have to move their breast tissue out of the way in order to gain access to the site. Always make sure you're being respectful when doing so. Now we'll be doing the same thing. Just breathe in and out as you feel the stethoscope move, okay? Alright, now I'm going to be listening for your heart sounds using the stethoscope as well. For this one, you can just relax, okay? During heart auscultation, it's important to explain to the patient that you are listening to their heartbeat, which is normally a lub-dub sound. The lub sound is the S1 sound and is caused by the closure of the mitral and tricuspid valves. The dub sound is the S2 sound, which is caused by the closure of the aortic and pulmonic valves. It's important to gain consent from the patient in order to be able to palpate anatomical landmarks to find these valves. On the patient's right-hand side to the right of the sternum, between the second and third rib, you will be able to hear the aortic valve. Directly across from this, on the patient's left-hand side, you will be able to hear the patient's pulmonic valve. To the left of the patient's sternum, between the 5th and 6th rib, at the intercostal space, you will be able to hear the patient's tricuspid valve. On the patient's left-hand side, between the 5th and 6th rib, at the intercostal space, you will be able to hear the patient's mitral valve. Next, we will be doing the ankle brachial index. This is used when patients present with cardiac issues, stroke, poor leg circulation, and/or leg pain. It's important to explain to the patient that this is used to check for peripheral arterial disease of the legs. When measuring ankle brachial index measurements, you want to ensure that your patient is in the supine position. When the blood pressure cuff is on the upper arm, the palm will be facing the ceiling. When you're placing the cuff on the lower leg, you want to make sure that there is no clothing that's going to be between the cuff and the skin. So for this patient, the pants would have to be rolled up, or the patient would have to change into shorts or a gown, and the socks would be removed. In addition, you want to make sure that the cuff on the leg is placed above the malleoli. The first measurement will be taken on the patient's right arm. It is important to palpate for the patient's brachial artery prior to beginning. You will then take the gel and put a drop of gel on the pulse site once you've found it, and then you will place a drop of gel on the Doppler before beginning as well. These same steps are repeated for each pulse that is palpated and each site that is measured. first sound was heard at 110. The second measurement is of the patient's left arm. Sorry. The left arm measurement was 102. This measurement will be on the patient's left foot for the dorsal pedal pulse. Although it was very faint, the first sound heard was at 116. This measurement will be of the patient's right foot using the dorsal pedal pulse. Although it is very faint, the first sound heard is at 106. Around 98, it starts to get louder. It is very important to make sure that you are wiping your patient free of the gel that's used and cleaning up appropriately. Now we will be calculating the ankle brachial index of the right and the left foot. For the right foot, it was determined to be 106, so 106 will be your numerator. For your denominator, you will take the higher of the two values that you got for both arms. On the right arm, it was 110. On the left arm, it was 102. So for both equations, 110 will be used for the denominator. For the left foot, we'll do the same thing, except we are changing the numerator to the value that we got on the left foot, which was 116. Both values are greater than 0.96, therefore the interpretation of ABI is normal, and the patient is not at risk for peripheral arterial disease of the legs.